Hi everybody, Ziv Simon here. I'm the creator of Surgical Master. Welcome to this video. And in this video, I'm going to share with you a really interesting case that is also extremely challenging for so many reasons. We're dealing with a very young patient that tragically lost an upper left lateral incisor and an upper left canine. And it's an extremely tricky situation to resolve from a surgical and restorative point of view. I was part of the team that involved the prosthodontist and oral surgeon, and we really put our heads together to try and figure out what is the best option for this patient. First of all, the reason for the loss of these teeth was that the permanent canine was badly impacted, affected the lateral incisor, and as they were trying to bring this tooth in, it basically damaged the lateral. The canine got damaged in the process, so the patient ended up losing two very strategically important teeth. And we know what happens when teeth are lost. There's an extreme ridge resorption. The extraction itself is relatively complex. And as we can see with this patient, we also have some attachment loss on the adjacent teeth. So this is a relatively large defect that is not easy to manage in terms of the patient's occlusion, also surgically, kind of hard to do. The decision was made to place two implants to replace the lateral and the canine. And this in itself is challenging in terms of restoring two adjacent implants in a deficient ridge. So we know that we need to resort to some sort of gingiva colored ceramics or pink porcelain. But the reason I saw the patient was to assess if there's anything we can do in regards to gingival symmetry. So if we look carefully at the ridge, this is following the implant placement. The implants were done in a two-stage approach, so they're basically covered by soft tissue. There's a planned uncovering, and during the uncovering, there will be an attempt to increase the volume of the soft tissue, but we know this is going to be very challenging because once we have two adjacent implants, the best predictor for an implant aesthetic success are the adjacent teeth. If they have great tissue levels, you can predict that you'll have reasonable aesthetics. But once you have two adjacent implants and tissue loss on the adjacent teeth, that's going to be very, very hard to manage. So if you look at the left central incisor, we're looking at a normal length of about 10.5 millimeters, but there's no papilla on the distal aspect, and there's actually some recession. Now, if you compare it to the right central incisor, it is short, so I was suspecting a process of delayed eruption. And the thought was if we could do some crown lengthening on the right lateral and central incisors, we can potentially create a better gingival line and maybe mask this big discrepancy. But regardless, it's going to be quite challenging. So I wanted to show you what was the analysis like. I did some digital simulation, and I wanted to show you the procedure as well. And actually, it's going to be broken up to a few videos. I'm going to keep those videos relatively short. Not everybody has a long attention span online. Okay, and I also think it makes it more exciting when we create several videos as a series, and I just like that. It's like a TV show. So basically, if you look at the left central incisor, we're looking at a normal length, so there's nothing that needs to be done. The right central can be lengthened. I also used my proportion gauge, choose proportion gauge, that shows that the proportions of the left incisor are almost normal compared to the right incisor that is short. So the way this works, if the tooth is as wide as the red lines, it should be as the upper red line. So we know we have this amount of tissue that we can resect. Looking at the lateral incisor, actually according to the proportion gauge, the proportions are correct. The tooth is as wide as the blue lines, and it's as long as the blue lines. So in terms of proportion, it's actually correct. So my initial assessment was that this tooth is absolutely fine in terms of its proportion, and if we do some crown lengthening, what's going to happen is that we'll expose some of the root structure, some of the cementum and dentin that will basically commit the patient to having a restoration on this tooth.